evening, everyone. My name is Brant Peterson. I'm sad I can't see you all tonight, but wanted to introduce myself. I'm the 2020 chair of the Catalyst Committee. On behalf of the emerging leaders of Tampa Bay and the Tampa Bay Chamber, we would like to welcome you and thank you all for joining us this evening for this exciting discussion. With that, I'll pass it along to Nicole to kick us off.
Hi, everyone. My name is Nicole DeNicola, and I am the Catalyst Committee co-chair for Emerging Leaders. I just wanted to do a few little housekeeping items before we get started. Since we are on a webinar, you all have been automatically muted, and unfortunately, we cannot see you. This is just to prevent any external noise or interruptions during the event. But if you do have any questions for our panelists, you can feel free to chat them in the Q&A section below. We will do our best to answer them. We may run out of time, but we're gonna hope to get to some of the questions. So with that, we'll go ahead and get started. As you all know, over the past several months, we have all heard the headlines: unprecedented, devastating, volatile, quarantine, economic shutdown, the new normal. So the goal of this vision series is to get out of survival mode and start looking towards the future. How do we all manage these sudden changes and adapt and overcome? What can we do to stay positive and keep our heads up and push past the pandemic? The goal of this vision series is to host these wonderful panelists who are going to help show us the way with their expertise in economic development, business support, policy writing, and of course, healthcare. With the perspective of these four wonderful thought leaders, we hope to paint a picture of what we can expect as we move forward into a world completely unprecedented in a few short months. We hope to be more prepared, armed with greater perspective and a deeper appreciation for community as well as our collective health and well-being. With that, I'll go ahead and pass it back to Brant to introduce our wonderful panelists.
Thank you, Nicole. I appreciate the intro. You all did not join tonight to listen to me, so I'm just going to jump right in and start introducing our panelists. We'll get started. First, we have Dr. Bob Rohrlack, our very own President and CEO of the Tampa Bay Chamber. We have Craig Richard, President and CEO of the Tampa Bay Economic Development Council. We have Representative Jamie Grant from the Florida House of Representatives, 64th District. And lastly, Dr. Lakshmi was unable to join us tonight due to extenuating circumstances, and we all know how crazy times are right now. Luckily, her colleague, Dr. Jason Wilson, was able to step in last minute for us. Dr. Wilson is an emergency medicine physician at Tampa General Hospital and research director of the USF Emergency Medicine Residency Program. We are so grateful that you're able to join us on short notice, Dr. Wilson, as it's extremely important to have the healthcare field representative as part of this discussion. A very warm welcome to these wonderful community leaders. Thank you all for joining us this evening. I'd like to begin our discussion by asking some questions around what you think this recovery will look like and what resources and recommendations are being provided to aid in a smooth transition as we look toward the future. Bob, I'd like to kick things off with you. Small businesses have been amongst the most affected by this pandemic and the ensuing economic shutdown. What resources has the Chamber been able to provide to assist small businesses through these difficult past few months? And what resources do you see the Chamber providing moving forward as we look to reignite the economy and safely get back to work?
Sure. Thank you, Brant. Thank you, Nicole, for coordinating this event. Thank you all for tuning in to be a part of this discussion. And thank you to the panelists for being here. What the Chamber has done very early on, when businesses started to have their employees either work from home or they just shut their doors because they weren't sure what to do, as everyone was being told to shelter in place, the Chamber started to look at how could we be a resource to not just our members, but to the entire business community. And you're right, small businesses were impacted dramatically. We've been referring to it as the hospitality industry and a lot of small business, they got struck by lightning. The rest of us heard the thunder and knew the storm was coming quickly and were able to do some type of preparing, but they really got hit hard. So on our website, tampabaychamber.com, we started to grow a resource site listing the resources at the local level, state level, and at the federal level for businesses to find out where they needed to go. As Congress was talking about the programs they were working hard to pass quickly, the PPP program and the other relief programs that they've been passing through the different bits of legislation that have been passed, we were starting with webinars on here's how to be prepared for what they're saying is going to come. What you need to be getting ready to talk to your banker, your accountant, your attorney, be prepared with, what records you need to go gather. A lot of the employment laws changed very, very rapidly. We had experts in employment law talk about here's what you as an employer now need to do and what's going to be working on. One of our executive committee and board members, Brian Butler, worked in the White House and helped craft the White House pandemic crisis response strategy. We had him talk about what strategies should be put into place. And we kept doing weekly webinars, trying to hit a hot topic that we thought businesses would want to know without duplicating everything else that was going on out there. For example, we did a webinar with 3 successful entrepreneurs, Marianne Ferentz, a successful restaurateur in the area, Scott Riley, who took a business from 0 to 30 billion in sales, and Arnie Bellini from ConnectWise, who recently sold a business and did extremely well. We had them just talk about, as a leader, what should you be thinking? What should you be communicating to your team? How do you work on the emotional side of this to keep your company and your business going so you're best prepared when things start to turn around? And just kind of shift the narrative. And one thing Arnie talked about that I have been recommending to everybody, it's a book he recommended, so I can't take credit. But the book is Bounce, The Art of Turning Tough Times into Triumph by Keith McFarland. And it's a terrific book about a business that's going through a tough time, how do they turn it around. And most of it is just the mental strategy that you work on. It's Bounce, The Art of Turning Tough Times into Triumph. And that's really been our focus on, yeah, we're all in this together, but think how you're going to come out of it when you start to come out of it. Focus on things getting better and how we're going to get to that point. That's really been the unique spot we tried to own from the chamber perspective.
I appreciate that thought and that advice. And I like that analogy that, I mean, some were struck by lightning and others heard the thunder. It's very fitting for Tampa Bay also. And just to add, I think I was on the call yesterday with Mayor Castor at the Chambers Face the Chamber webinar. And she just mentioned that small businesses are truly the backbone of Tampa. So it's going to be vital to support them during this recovery. So appreciate that. Moving forward, Representative Grant, speaking of recovery, a lot of our guidelines are coming from the state level and seem to be changing rapidly. Can you take a moment and walk us through what the state plan is to peel back these social distancing orders and move toward a full reopening of our economy? What is it to get people back to work, establish some form of normalcy, and begin the road to economic recovery?
Yeah, I think it's a great question. I think there's really kind of 2 answers, right? There's the substance of it, and then there's also the how we communicate it. One of the things you find in the policy world is that you can have the greatest idea in the world, or what you think is the greatest idea in the world, get it passed through the legislature, get it signed by the executive, and then watch the execution fall on its face. And we can find examples of Republican or Democrat administrations at the federal level or state level who have learned that lesson the hard way. And so quite frankly, we're seeing that a little bit with the unemployment situation over at the Department of Economic Opportunity and the challenges we have with the infrastructure there. But I think when you ask the question about kind of how we get back up and running, I think one is the substance. And what the governor has shown and what we have continued to do as his allies in the legislature is look at the data. We have tried to, at every step, look where the science is taking us, not to let fear-mongering or hyperbole or politics take control, but to actually look at the numbers, figure out what's actually happening, and understand the gravity of the circumstances. I think when this thing is all said and done, I think we're all probably moving closer to a conclusion that some of us had sooner than others, and not to say that people were right earlier, but we could have just easily been wrong. I think the reaction to the disease from direct deaths and indirect deaths is going to end up being a lot more than the actual virus itself could have posed. Now that we start to see the evolution of the science and know more, I think it's important that we continue doing what we've done all along and put a strategic and safe pathway to opening. And so what we've done at the state level is look at what are clearly the safest and most responsible places to begin the reopening, to try and restore trust, to try and let people know that it's okay to be outside. It's probably good and healthy to be outside. It's probably good and healthy to stop the bleeding and the execution of small and mid and large size businesses that are happening all around us. It's important for us to understand that a reopening has to happen and that it takes all of us. We in the business community understand that no business survives without a product, a good, or a service, but it also takes consumers. And I think one of the reasons this pandemic has been so devastating is that it has eroded consumer trust by and large, with people not going out, people not shopping, people not consuming, people not doing. And so that hurts the business. It leads us to a scary situation where deflation becomes a reality potentially. And I think any of us that understand what deflation means and what that looks like at the macro and micro levels get really terrified about that. So we've got to continue what we're doing at the state level to go phase by phase by phase with smart and strategic and intelligent opening. I think secondly, and this is maybe actually the harder part, is the communication. Unfortunately, we live in some of the most politically divisive times, and the fact that I have an R behind my name or wear the metaphorical red jersey means that I could cure cancer and people are still going to want me to die a slow and painful death. The reality is we are in a very, very, very difficult, historic situation. I think it's incumbent on all of us to put all politics aside and to figure out how we stop the bleeding and how we mitigate the devastation that's happening all around us. That's going to take probably at best several quarters and more than likely multiple years to see a complete rebound and recovery from. And so we've got to be communicating that from the state level in cooperation with our friends at the federal level. We've also got to be doing it at the same at the local level. And so I think everybody's got to play their part, make sure that we're looking at the data, we're continuing to do the phased reopen to restore the trust, and that people can trust that it is safe and that they do know that we can be on this path to returning to normalcy or a new normal.
Thank you. Agreed. I think it's a good opportunity to put politics aside. It's a unique scenario that we're all in the country, even the world together. So good points in that regard. Craig, continuing that message, the economy, as we're talking, has taken a massive hit. EC was tasked by the city and the county with the job of creating a recovery task force focusing on the long-term economic recovery, workforce retraining, and business support. What does that process look like? This is new for everyone. So are you looking to other state and local governments, other EDCs for best practices? And then finally, as we look towards reopening and recovery, what have been some of those recommendations coming out of this recovery task force?
Good. Well, thank you, Brant, and thank you for inviting me to be a part of such an esteemed panel. It's good to see everybody. It's always a great opportunity to sit on a panel like this with some noted experts in the respective fields. So thank you again for allowing me to be a part of it. About a month ago, maybe a little bit over a month ago, the city and the county approached the EDC to develop a set of recommendations that can help guide the local economy into a swifter recovery. And they wanted us to focus on a couple of key areas. One is, based upon some of the data that we were receiving, we knew that we were going to be hit hard in certain industry sectors, particularly industry sectors that are consumer-facing industries. We knew that they were going to experience some significant job losses and significant closures. And so one of the things that they wanted us to focus on was, how do we quickly get people back to work? How do we help the folks that have been dislocated from some of their positions find new opportunities? What type of training programs can be available to help some of these individuals? And what can we do to support our own local businesses to be prepared to reopen, and then to reopen and to start prospering again? So we convened a group of about, I don't know, I guess it must have been about 75 or so business leaders. And it ranged from industry association people to education leaders to nonprofit associations, community leaders, small business owners, nonprofit owners, executives, just a host of people that we thought could provide a good sounding board into the pulse of what was going on in our own local community. So in addition to all the data that, you know, we're privy to, folks like myself and Bob, Rohrlack and Santiago and John Flanagan, we are all part of national associations that they were just ginning out a ton of information. So we had access to a lot of the information and strategies and tactics that were coming along nationally. And so through conversations with our peers across the nation and internationally, as well as our own data that we received and the feedback that we were getting from our task force, we were able to craft a set of recommendations for our elected officials. We organized about 70 of these leaders into 3 different groups. One group was the education and workforce group. Another working group was the business support and retention group. And then we had another one that was about recovery strategies. And we came together on several different occasions to present information that we had been receiving across the country, as well as our own data that we had developed. And then we started seeking input and information about potential strategies that would work for our own local area. Fortunately, we were able to wrap this process up last week. We've submitted a list of recommendations to both the city and the county, the city of Tampa, Hillsborough County, as well as Plant City and Temple Terrace. And in those recommendations, we basically focus our efforts into these key areas. One thing that we heard loud and clear from businesses was less regulations, less strings attached to the various resources that are available to us, and the different types of support that they needed. And so I think you'll be hearing more about that as some of these programs are being developed and refined from our municipal governments. We also heard about the importance of making this an inclusive recovery, a recovery that doesn't just benefit one sector or one group of people, but an inclusive recovery that every segment of our community can benefit from. And, you know, things along that line included how do we ensure that certain populations are getting the right type of technology or have access to the right type of technology and equipment to be able to apply for different types of programs. We talked about the types of training and workforce programs that are needed. And, you know, our local experts with Career Source Tampa Bay and Hillsborough Community College, they weighed in heavily on those types of programs. So it was a pretty comprehensive set of recommendations that we provided. We knew that, you know, because of the environment that we're in, it's a very dynamic situation. So the recommendations needed to be specific enough to our own local community, but broad enough that it could be flexible so that it could be tweaked as these programs are being unrolled. So you guys are the first to hear that we will be releasing those recommendations tomorrow. And then we also have a set of a toolkit that we'll be releasing on Monday to help businesses prepare for reopening.
That's some good content right there. We can peel back the curtain before the public is to see it, right? Moving on, Dr. Wilson, thank you again for your flexibility and for being here tonight. We appreciate it. This is first and foremost a global health issue. We just heard some of the economic recovery recommendations. I'd like to ask you, what are some of the important recommendations and steps coming from the healthcare field that we should consider in order to safely reopen?
Yeah, so thanks a lot for having me. I'm not nearly as witty or funny as Sita Lakshmi, but I'm really happy to be here and hopefully can contribute to this panel of experts. So I think when you think about what the word public health or the phrase public health meant 4 months ago to the general public, it's totally different now, right? It's a discipline or a field that's in our lexicon. We know terms like R0 and antibodies and testing and prevalence rates and incidence. So all these terms and all these ideas have floated into our daily lexicon. So the world of public health has not only changed, I think, for the public, but also even for medicine. We think about medical providers, what we do on a daily, day-to-day basis, we see one patient at a time, and we think about their healthcare and their relationship with us as a physician. But, I think now physicians and the public have really understood that we have to think about population health at the same time we think about, single patient health, and then what the ramifications of population health are as well. So we make decisions or recommendations about policy. We recognize that those have ramifications that we're talking about tonight. They have economic ramifications, they have business ramifications, they have multiple ways they can touch our patients' lives, socially, culturally, everywhere. So I think all encompassing, how we view and weigh public health has really changed. And I think what's been very impressive is the public's ability to recognize data and how to interpret that data. And I think one of the lessons we've really learned here is how important it is to have really good, transparent data available to the public for interpretation. I've been super impressed by the questions I've gotten from the public who have understood and looked at and analyzed, been able to pick apart what the data looks like in Tampa versus New York City, for example. Hey, this seems to look a little different. What do you think? Hey, how's reopening going? It doesn't seem to be so bad. Is that accurate, right? Those kind of questions are really important questions. And, without transparent, good data, it's hard to get there. I think one of the things we learned is that one of the difficulties of getting to really good, transparent data is that a lot of things were siloed before, and a lot of different municipalities or localities had different ways to report or to define that data. So, moving forward, I think we've all learned that we have to really understand what our definitions are, how we want to feed that data back to somewhere, how we want to coordinate that data and then distribute it back out, and what that means. I think that's going to be one of the big important lessons moving forward. But overall, we've done some amazing things here as a public, as a population responding to this, right? We mostly followed our leadership, and we mostly followed recommendations, and we did flatten the curve, especially in this area in Hillsborough County. We flattened that curve fairly quickly by following some good public health measures. And just as a reminder, those public health measures, right? The important ones were things like washing our hands. Things like beginning to social distance a little bit, avoiding big groups of people. And then as we got a little bit more intensive, trying to, even social distance more to protect our most vulnerable people in our population. So what's amazing is it's going to help us with really every type of infectious disease process, right? So we saw our flu rates just plummet during this because we were doing such a good job of dealing and mitigating COVID. Flu B disappeared, right? So we're going to be better in the future at other infectious diseases too. We're going to see, I think we're going to keep, some of these good habits up. I hope we're going to keep some of these good habits up. That even physicians have struggled with. Hand washing for physicians, by the way, has been a struggle for 100 years. I don't know if people recognize that, but that's been a real struggle to get physicians to consistently wash their hands post-germ theory. So I think that's taken very seriously now. I don't think we're gonna have to remind people to wash their hands anymore, and we're gonna see all kinds of rates go down. I think what we have to remember is we've got to stay flexible as a public, right? We're trying to balance now economic tools and economic changes with a known virus that's there. We're doing our best to make recommendations based on data. Should we wear a mask? Should we not wear a mask? Look, it certainly doesn't hurt to wear a mask. It probably helps to wear a mask when we're close together. If you're by yourself at the beach, you probably don't need a mask, right? So we have to kind of think about these recommendations, how they best make sense to protect other people. And you probably err on the side of caution right now. This is a new virus still. And so the data we're getting is new. If you go back, I've seen clips on the internet of, Fauci or something saying you don't need to wear a mask. There's clips of me on saying you don't need to wear a mask yet, but that was in January or early February, right? And so that's a different place, and we weren't trying to open up a business, right? And so when we think about opening up a business, trying to make sure this keeps on going smoothly, and things are actually going pretty well right now. After reopening, our number of new cases, except for a little tiny blip that never created a trend, has been pretty flat. And that's pretty reassuring. That's both at the Hillsborough County level and the state of Florida level. But we have to watch that. And if we start to see a change in that trend of new cases, we may have to have new measures or roll back some measures and be willing to kind of roll with those punches. And so you're going to see a lot more collaboration, I think, between healthcare and business, healthcare and other organizations. Right now, Tampa Journal has the partnership with the Florida Aquarium. I think that type of partnership is novel, but you're going to see more partnerships like that. And for those who don't know, that partnership is essentially Florida Aquarium turning to the experts at Tampa Journal and saying, hey, we want to reopen this place, but we want to do it in a really safe way. Can you please give us some recommendations that make sense to do this the right way? And that's happened now. And I think that's what we're going to start to see more of as we bring places that are going to have, by definition, large crowds of people. If we want to have those things in our lives, we're going to have to do things a little different and follow some recommendations we might not have seen in the past. I think that's how public health is going to look moving forward. I think it's how we're going to have to act as individual citizens, be willing to follow some of those recommendations. We can participate in the life we want to live and enjoy all the things we have here in Tampa.
It's certainly a difficult balancing act, but we appreciate all the work you're doing, all the work that the frontline healthcare workers are doing for us. So thank you. I know I've learned a lot as a normal citizen in the past 3 months. I had to learn how to pronounce epidemiology.
Right?
Right.
Your honorary degree is going to come in the mail. You'll all get.
Appreciate it. I'll take it. Definitely washing my hands more too. Anyway, with that, this next one will open up to the floor. I've tried not to overuse this word here. It's not my favorite, but it's a big buzzword. It's the new normal. So in your eyes, the panel, to you, what is this new normal? What are the long-term implications of this virus and the associated economic recovery?
Yeah, I'll start off with that. I think we're seeing some of that now, how people are acting differently. Some people are ready to, let's just get back to the way life was. And some are saying, I want to, but I'm not quite ready. Some people want to wear a mask when they go out. Some say, I'm done with the mask, I'm not wearing one ever again. So we all have to accept people are in different places on how they're getting comfortable with what society is going to be. And just like before, we need to accept that people are different. We need to accept that people are receiving and reacting to this differently. So don't give somebody with the mask a hard time. Don't give somebody without a mask a hard time. Just make your choices, live your life with it. But I think we're going to continue to work back towards what we all were used to. And if you look at past crisis things we've lived through, whether it was the recession or some of the hurricanes things we've gone through, we have bounced back. It's just how long the bounce takes to come back to what that is. But I think this one is going to make us think differently about being a little more careful with our health. We're going to have to be. And just how we all react and listening to the good advice from the doctor on what we all need to be doing, washing our hands and touching the face, all the things we're being told we shouldn't do during flu and cold season that we always tell little kids not to do, we need to be doing as adults. So it's just working our way back to that is what I think is going to happen. And businesses are just going to learn how they need to adapt now. We're doing it with, we're buying the stickers put on the floor on 6 feet, 6 feet, 6 feet. We're going to be setting up events as we start to host events again with no more tabletops of 10 and maybe a tabletop of 4. And just figuring those things out now and seeing how we can progress as things get back. And, all of us are hoping and praying that there's not a round 2 of this that we have to go through. It's just how do we work back to what we all were used to seeing before and just be patient with it.
Sure, great. Any additional thoughts?
Jamie, you're on mute.
James on.
You trying to talk?
Sorry, I think the host muted me because I had some background going on and I should have checked. My bad. I think Bob kind of touched on certainly the high level, but I think one of the things that I'd add to it is it entirely depends on how we as a public individually and collectively respond. And Bob touched on some of the examples, but one of my favorite quotes in American history is Ben Franklin being asked when he walked out of Constitution Hall, what form of government did we get? And he looks at this lady and says, a republic if you can keep it. And I think when you go through crises like we're going through right now, regardless of how real or perceived, there's no doubt that this has turned into a pandemic, regardless of how lethal the virus is, because of the way we've responded to it. And history will judge us whether or not we responded overly harshly, too much fear, or whether we were prudent and strategic, and that's why the curve flattened. But I think as we move forward, it's incumbent on all of us, and one of the charges I'd give each of you is ask questions and critically think. When you're seeing things in the news, whether it's supporting people you like or don't like, or causes you like or don't like, or positions you like or don't like, ask yourself if it makes sense. And Dr. Wilson talked about the data. And look, it's a scientific fact that anybody in a white coat is inherently smarter than the rest of us. And kidding aside, when Dr. Wilson talks about the data, one of the exercises and one of the challenges that has come out of the media's coverage of the Department of Health website, if y'all have not been to the DOH website and you really want to dig into some of the data, we've been lauded as having one of the most robust and transparent dashboards anywhere in America. And then, of course, there were some headlines that hit last week and people started asking questions. Well, if you don't understand how siloed data is, even at the state level, before you get into the different local municipalities and subdivisions of those localities, and you don't understand that in some scenarios, we're trying to report data to you, the public, that's coming into us on paper. We're getting everything from a paper record that's 3 or 4 days old to contemporaneous data calls by way of API with organizations like Tampa General. And so we are trying very hard to make sure that we're producing that information to you. But as the public, when we think through this and you ask yourself, what information can I rely on? I'd encourage you to think through and ask yourself, hey, why would it be hard to get that information out publicly? And what should I believe? Because when you actually dive into what has been put before you with the DOH dashboard, it's really impressive. And it really does validate the fact that we have done the things societally here in the state of Florida to try and bounce back. So critical thinking, how we respond when we're willing to kind of take the step back out there and take the responsible, safe things, is going to determine how long we're in this period. We can absolutely affect the length of time at which we get back to the quote unquote new normal. And so I think if we're all responsible, if we all follow the science, if we all do what makes us feel comfortable, then I think the period of time until we get to this new normal will be much shorter. But the last thing I'll touch on, and Bob touched on it, Floridians are strong. We're resilient. We have faced all sorts of crises in our lifetimes, regardless of how long you've lived in this state. Whether you remember things like Hurricane Andrew, or you remember 3 consecutive years that we've recently had of devastating hurricanes hitting different parts of our state, we have always and we will continue to bounce back because that's who we are as Floridians. And I look forward to working with all of you on that pathway, but knowing that we can all shrink the timeline to that new normalcy by being intelligent, by being a selfless group of people that say, how do we get in the same boat, row in the same direction to get this state open back up? And I'll close by saying on this front, when we talk about the new normal, I don't think it's just enough to say that Floridians bounce back and we resolve and we get back out there. We have been talking about it as a chamber, as groups, as the business community, as friends, as leaders. Florida is in position to lead this country over the next 10, 20, and 50 years. And the way in which we get this state back open right now has the opportunity to be rocket boosters on that front. The most meaningful thing we can do is show people that there are jobs in Florida. The most meaningful thing we can do is show businesses that they're going to have a climate that's deregulated, focused on their ability to pay their employees, grow their business, and allow market demands to happen. If we will open this state up for business in a safe and responsible way, I think we'll accelerate the pace at which we own the next 10, 20, and 50 years in this country. And it's because of young professionals like you. It's because of Bob and his work at the chamber and the businesses that make it up. But if we'll work together on that, I think we really do have the opportunity to lead this next 10, 20, 50 years here in America. And it's an exciting time to be in Florida, regardless of how difficult it is today.
Appreciate it, Jamie.
Brant, can I just say something about this new normal idea? One of the things that I think we're used to in hospital situations or healthcare and just going to your doctor's office is that we certainly want the whole family to be involved in medical decisions, and we certainly want visitors and all kinds of people to be involved in a patient's healthcare. And while it's certainly safe now at Tampa General and all the other hospitals in this area to come in and have procedures and to be seen as patients, given all the testing availability we do have and the processes we've designed in place, it may be a while before we can have visitors return to the healthcare setting. And I think that's a real challenge for people. And I just want to put that out there because I don't know if that's going to go away tomorrow. That might be here with us for a little bit. And it's one of the toughest things as a physician to have to, navigate and deal with my patients' families, because it puts them in a tough situation. And even in my own family, right, not being able to go to appointments with sick, or loved ones who are, having medical procedures. So I just want to make sure everybody understands that we recognize that, hospitals recognize that, but we really want to protect our patients and be able to keep on doing these procedures. It may be a little while before we can have, physical patients, families back. And so you're going to see a lot more innovation around telemedicine and telehealth, not just for family visits, but also, interestingly enough, and economically, interestingly enough as well, you're going to see some changes that are going to stick with us post-pandemic around telemedicine. We've really struggled in the past to be able to appropriately bill for the services that are provided in a telemedical type of way. But I think what we learned during the pandemic is we had to. And so there were some changes made by the reimbursement agencies out there. And what we learned was that patients actually kind of don't mind it for especially like a primary care type of visit. And it's sort of enjoyable sometimes to do things. We can have more interactions sometimes. So I don't think that's going to go anywhere. And then we'll have to navigate that challenge in difficult patient situations. Most hospitals have some way to get families to at some type of way to see the patient if it's an end of life type of scenario. But there are certainly some difficult scenarios that are being faced out there in Tampa right now by families.
And I just want to add on to what Dr. Wilson was saying. This virtual environment that we're all experiencing now, I think it's going to be here to stay for a while. That is definitely going to be part of this new normal going forward. We're seeing that in economic development. I mean, Adam Myers, who's also part of Emerging Leaders, everybody knows Adam, giving Adam a big shout out. But we're in the process now of actually doing virtual site visits. Businesses that are looking to expand and grow, we're doing virtual site visits with them, meaning they don't have to set foot in Tampa. We take them on a virtual tour of the various assets that we have to offer right here. And that virtual environment is going to extend to not only how we're doing business, but also the physical environment of our own workspaces. All of you who are now considering, if you haven't started going back into your office, most of you will start to see there's going to be certain physical requirements put in place. So what does this mean for the physical work environment? Before this pandemic hit, the physical work environments the pendulum swung all the way to how many people can we cram into an office to now, how many people, how much space do we need with a reduction of physical presence of workers in an office. So you're going to see some vastly different types of workspaces that will be coming out. And I think that's going to be moving forward. I think that's going to be here to stay with us for a while. Businesses have to not only prove to consumers that they are safety minded and conscious, but they'll also have to prove that to their own workers. And I think that's going to be incumbent for all businesses moving forward as we embark upon this new normal.
Thank you, Craig. Jamie, I think I'm going to jump back to you. This is something I want to touch on. You mentioned it's so easy to get caught up in these headlines. It's been such a whirlwind of a year. But as the Catalyst Committee, we focus on public policy. And oh, by the way, it's still an election year. And easy to forget that with all this going on. So we want to remind our members to register to vote. It's still an election year. But how do you see all this affecting the elections moving forward and policy writing in Tallahassee?
It's kind of like anything in this environment, and I hate to kind of beat a drum, but I think we live in an environment where if the red team's for it, the blue team's against it, and vice versa. And there's very few situations where people come together and say, hey, that's just good common sense policy, regardless of who proposed it. And one of the examples that I would offer up is a lot of the fuss about vote by mail. Florida has been a leader for a long time and has, for I think my entire lifetime, at least as long as I can remember an election, you've been able to request a ballot by mail and mail in your ballot. So anybody who is concerned about the public health or public safety components of going to a precinct and having to drop off a ballot, contact your supervisor of elections. Craig Latimer does a great job in our county of efficiently running our elections. But you can just Google and go to the Hillsborough County Supervisor of Elections site and request an absentee ballot. And so that's just one example, right, where the narrative of, one team is for mail-in voting and the other's not. The reality is everybody has long believed in the notion of vote by mail. There's some efforts to try and subsidize it and do some different things that I think is probably where you get some of the policy disagreements. But with respect to can you get a ballot and vote by mail without having to go to precinct in the state of Florida, that answer has long been yes. And to my knowledge, there's not an attempt to change that in any way. If anything, we're trying to make sure that process runs more efficiently. So I think that's one that's kind of out there as an issue that people may be kind of misled on by people trying to politicize something. And then I think secondly is understanding how the campaigns work. I mean, look, my team is in constant conversations. We make the joke that we don't know if me knocking on a door right now is losing a vote or if me knocking on a door is missing out an opportunity to vote, to talk to a voter, right? How does somebody respond to me showing up at their door? Do they expect me to be in a mask? Do they expect me to target them digitally or with mail or on television? What does campaigning in this environment look like? And I think you're going to see a lot of people make different bets and different guesses with the campaign resources they have. I think one of the sad realities is I don't think there's any way to dispute that this situation heavily skews towards incumbents. I think incumbents are far advantaged in an environment where events are not happening and somebody who's never been on the ballot or doesn't have name ID, doesn't have the ability to really get out and kind of run a grassroots campaign as a first-time candidate. So I don't ever think that's a good thing. I think elections should be robust and competitive, and it's a shame that in an election year we're seeing it be much harder to try and fire people, even if that means I get fired. Which friends of mine in Emerge, Andrew Smith will vouch for you. If I get fired, I live a much better life and I get to see some friends more often. But I do think we should have a robust environment that people like me have to fight to defend our records and say, hey, I want to keep doing the work I'm doing. And then lastly, I think you look at how it looks in the policy world moving forward. And I think what you see in these situations is sometimes naivete and sometimes just political opportunism. But you'll see a lot of proposals roll out next session that are very reactionary to what we've just been through, and maybe kind of overreach and have an impact on business that is either intended or is unintended, but in both scenarios is negative. I think at the end of the day, if we will kind of stick to what we've all been talking about being intelligent, embracing the new normal, understanding the things that we've learned that we need to do a better job of through this exercise, but to safely and efficiently reopen the state, I think what we'll watch is whether it's elections or public policy, we'll get to that new normal faster. But I don't think there's any doubt next session is going to be dominated by some attempts, whether it's the debacle with the unemployment website, whether it's procurement reforms, our digital infrastructure that's severely lacking in the state. There's a lot of things we need to look at coming out of this. And I think you'll see some people target that pretty strategically and efficiently. I think you'll see some people try and make headlines with it. I think at the end of the day, what we've seen in the political process in Florida is that those who can navigate Tallahassee tend to be the people who focus on getting things done rather than getting the headlines. And I think you'll see that kind of come out of this situation where we all understand that from the governor's office to the Senate to us in the House, that we have identified some real issues that need to be addressed, that our constituents deserve a lot better than what we've got at DEO right now with the unemployment website and Connect. And looking through how we are positioned to respond to these kind of things. And I think you'll see it, like I said, in every policy area. Elections no different. Again, I'll say this. I'll close here in a business. The principles of supply and demand, principles of buying power, do not care what political party you're from. And so us as voters, and I say that as somebody who votes for both myself and others, we as voters are the consumers. We get to tell people running for office what's appropriate, what we like and what we don't like. I think we ought to be focused on rewarding substantive behavior and rewarding people who have tried to kind of lead or have a plan to lead coming out of the pandemic, more than some of the divisive political rhetoric we're getting from both parties at all levels.
Yeah, definitely something to keep front of mind through all of this, this mayhem. We encourage all of our members to register to vote. Get out there and vote, mail in your vote, whatever it takes. Democracy doesn't stop for a pandemic, so you got to keep moving forward. Another one I wanted to get to, this one's really for Craig or Bob, both of you, anyone else that wants to answer. This is regarding our work landscape. We've touched on it a little bit, just how it's changed and how does the workforce of the future change and adapt with it. And there's a lot of young professionals watching tonight. What should young professionals be focusing on now that is different from the skills and careers we were preparing for a short 3 months ago?
I'll start off with a pretty evident thing that I think most professionals, not just young professionals, but all professionals will need to be prepared for, and that is working remotely. That's that's something that is going to stick with us. But in terms of the workforce, the types of economic opportunities that are going to be available, I think we're really at you're starting to see a sea shift in the types of jobs that are going to start becoming available and what will not be as available. We're going to see strong increases in distribution and logistics. When you think about shipping, Amazon, Publix, all this economy right here is just getting ramped up. I think you'll see the service industries get hurt some as a result of that. So we have to be prepared to look at how these changes in these industry sectors are going to affect our workforce, not only what's available, but in terms of the types of education and programs that are going to be needed for these new jobs that are coming about. But we're in the middle of a change. And I think our ability to adapt to that, which I'm confident that we will, is going to will tell the difference on if you have economic opportunities in the future or not.
Yeah, I agree with Craig. The beginning of last calendar year, so 2019, traffic was really bad. It was having a huge impact on attendance for committee meetings at the chamber. A lot of the events we were doing, people coming in late because they were fighting traffic. So we started this shift. We were actually borrowing Zoom equipment to do meetings. And I was really afraid attendance was going to fall through the floor, that people wouldn't come. They'd say they participate by Zoom, but they wouldn't. And we saw attendance start to creep up. More people involved, consistently involved. So they understood the issue from the previous meeting we were discussing at the next meeting. And I had to acknowledge, okay, this isn't what I expected would happen. It's going in the right direction. And then the shelter in place orders started to happen. And we started to do things like our board meeting. We saw attendance go up 50% for our board meeting. So people were seeing, we can do this. Technology is at the level we can do things like we're doing right now to have this meeting this way. So I think we're going to get more strategic. We're already starting to monetize some of the events we're going to be doing in the near future because they have value. And just like we would if everybody came into one room and paid to attend, we think it's worth monetizing to participate in the Zoom side of it. So we're going to be looking at what's the best way to do the hybrid of physical attendance or Zoom attendance and how we will integrate that. And we're doing research on it. We're talking to other organizations, how they're doing it, and just trying to figure out the best practice, first and foremost, to be a resource to our members, but making sure we can continue to support ourselves to continue to be that resource, because the chamber is still a business to work through. So I think everybody is working on how to figure all that out. We've had remote banking, we've had remote telemedicine. A lot of things are going that way. We in the service side have had to figure that out as well, just as we saw the hospitality industry, the restaurants who were used to having dine-in quickly shifted to the carry-out or delivery mode if they weren't already doing it. So it's being adaptable is how you're going to be able to make it through with the process. And one of the hardest facts that was mentioned during the webinar we did that I mentioned with Arnie Bellini and Scott Riley and Marianne Ferentz is there will be winners and losers in business as we go through this. Some that are able to shift and adapt, and those that wind up freezing and don't know how to adapt through it and get through it, or they weren't financially or business-wise prepared for this. You know there's going to be a downturn. There'll be another one. There's going to be some other economic crisis, health crisis. Something will come again. Weather crisis, something. Businesses need to be prepared. And how do you best be prepared to inch your way through this moving forward and then be in a stronger position as you do that? We've hosted a webinar that I participated, a reciprocal webinar this morning, where we talked with chambers in Ireland, Spain, and England about what is it like, what are they going through? And the worst we're seeing on the shelter-in-place directives, wear gloves, wear masks, how many people in a facility at any time, is nothing compared to what we've seen in other countries and how strict they've been. It's still in Ireland, you're only allowed to travel 5 kilometers from home. For a long time in Spain, you could only go outside to walk your dog. Literally, your kids couldn't go outside. We didn't have that you weren't allowed to go outside. You were encouraged not to, but it wasn't that you weren't allowed. So we've had easier than a lot of other countries have had in going how to practice and go through this. But we just need to be smart on how we're going to go forward. And I think technology is going to increase being an asset to how we do that and how we get that done. And it's harnessing that's going to help those succeed.
Thank you for that perspective, Bob. That's good to hear. We're already under 10 minutes. It's hard to believe. Just want to give a time check. So we'll bump through a couple more questions and wrap it up on time for everyone. Building on that, one thing, a goal of this vision series was to carry a positive tone moving forward and kind of flip the script. We've heard a lot of negative headlines as we've discussed. So one question again to the full panel is, what are some of the positive changes and opportunities that have or will come as a result of this pandemic? The doctor mentioned telemedicine or maybe remote working, but anything else the panel wants to add?
Well, I'll start with, and I think we're going to see this pretty immediately, in that Tampa is going to be considered a very attractive location, especially to large, congested urban areas that have seen significant impacts from the COVID pandemic. We're already experiencing companies that are looking at Tampa because they want to think about the future and how that company may see itself operating during crises such as this. So I think Tampa is very well positioned to be a beneficiary of some of the out-migration that may occur from some of these larger urban complexes.
Great.
Yeah, and I'll just add a quick thing. The book I mentioned, Bounce, The Art of Turning Tough Times into Triumph, excellent suggestive read on looking at that. USF last week started a certificate program in post-crisis leadership. The second session was last night. You can still sign up to attend the webinars. They've closed off the number of participants to get the certificate, but you can still participate. Last night was on how to market through a crisis period, how to continue to position yourself to be in the right shape coming out of these kind of situations. So I encourage everybody to look at the resources around for what's happening and what's going on. There is a lot going on that's available for businesses and what's happening. We're talking to the chambers in the region as well as chambers around the country and around the world. Craig's talking to his EDC counterparts. All of us continuing to gather information and then disseminating it out to business is how we as a community are getting stronger and stronger as a whole region. So it's how we continue to stay integrated, and everybody look for ways you can still stay in contact with customers, with clients, with your friends, with your cohort, just to stay in that social aspect of being involved with what's going on around you.
Great.
Grant, I think in healthcare, we saw things we really couldn't have imagined before this in positive ways. So we talk a lot in healthcare about patient-centered care and driving value from the patient's perspective. And that can be really, really difficult to do just because of the way that disciplines work in medicine, the way that the kind of timing and cadence of patient care works, the way reimbursement works. It's really difficult to do that, but we got a chance to really get a fresh slate and have the hospital and the regulatory agencies sort of say, look, we just want you to do what's best for the patient, design something that makes sense for the patient, and go about it that way. And so you saw emergency medicine, infectious disease, internal medicine all working together every day, rebuilding, restructuring the hospital, the flow of patients, the way we think about patients, and ways that we would have liked to done, but really never could do just because of the way things work. You saw teams of physicians who don't normally work together, working together. We were able to take research projects from the bench and safely move them all the way through to utilization at the bedside within a month. We took 3D swabs as we ran out of swabs from a USF, Michael Tang and Summer Decker's labs at USF, and ran them all the way through to become the standard of care at Tampa General within a month. That's unheard of, type of movement, and a safe, and doing all the right safety things for the patient. So I think for me, and one of the messages I want to make is we were able to imagine doing things we couldn't have even imagined before because we saw it happen. And so that happened at the bedside, but also happens at the grander scale too. We can now see where we're able to shape and drive change at both the individual patient level, the hospital level, but also at the population and society level in ways I don't think we recognize we can do still. We're just so wrapped up in the day-to-day, but we have this ability to rapidly mobilize and drive change in the right direction for patients and people.
Perfect way to wrap up. Thank you, Doctor. We're just under 3 minutes left, so I want to be conscious of time. I want to thank all of our panelists for joining us. And in closing, I just want to close by saying, as we begin to embark on this new chapter, let us continue to remind each other that we're in this together and we're stronger together. We have resources available, as we heard tonight, that we'll share with you. The Tampa Bay Chamber and Emerging Leaders are here as resources as well as we move forward. We encourage everyone to continue to be responsible citizens and practice safe social distancing in accordance with local guidelines. Lastly, we encourage everyone, as we just heard, to continue to focus on the positives. Spend more time at home, knock some projects out, stay connected with relatives and friends, enjoy the outdoors, support your local businesses, and most of all, enjoy the break from traffic and commuting for a short while it lasts. While it's really difficult and the future is uncertain, we all have been given a chance to hit the reset button and reprioritize. There will be opportunities and successes that come from this. And we're confident that our community will continue to push past this pandemic and emerge stronger. Emphasis on emerge. I want to do a shameless plug before closing. If you're not a member of Emerge and you enjoyed the content tonight, we'd love to have you. We'll follow up with a membership link in the email following this meeting. Everyone, thank you all for joining us. Thank you to Emerge, the Chamber, all of our wonderful panelists. Stay safe and have a good rest of your evening.